Welcome to another episode of the Empowered Fertility Podcast, the place where we dive deep into all things fertility. I'm Dr. Brenna Squires, a clinical psychologist and fertility support coach, here to bring you the knowledge, resources, and expert insights you need to feel confident along your journey to parenthood. So let's get started. Most of us know that hormones pretty much run the show when it comes to fertility. But did you know that each hormone plays a specific role and they have to show up and stand out at just the right time for ovulation and conception to actually happen? And did you know that those same hormones have to be at a specific level in order for a healthy full-term pregnancy to occur? And one of the biggest stars in all of this is progesterone. And on top of that, progesterone is not just for women. Progesterone stands out and helps men's fertility too. So if you've ever wondered about progesterone and you found yourself Googling, what is progesterone and how does it help me get or stay pregnant? Or how can I boost progesterone in my body? Or even what is the right amount of progesterone I'm supposed to have at this time in my cycle? Well, if you've ever wondered or Googled those things, this is the episode for you. If you love learning about health and fertility, make sure to hit the subscribe button so you never miss an episode. And trust me, you do not want to miss this one. I'm talking with Dr. Aimee Duffy. She is a board-certified physician who specializes in functional and integrative healthcare. She's got over 20 years of experience. She's the best-selling author of Normal Doesn't Have Side Effects and Why Can't She See Me? And you might have seen her on TV or heard her on other podcasts. So I'm thrilled to have her here today. Welcome to the podcast, Dr. Duffy.
Awesome. Thank you for having me. This is great.
I am super excited about this conversation because, yes, I am one of those people that have Googled all about progesterone. So I'm really excited to get your take on that. Before we get into that, do you mind sharing a little bit about what got you interested in functional and integrative health in the first place?
Absolutely. So I always take this story way back to when I was little. So when I was little, tiny, well, not tiny girl, but little girl, I absolutely loved babies. And if I could get my hands on holding anybody's baby, I wanted to hold babies. I wanted to play with babies. And I had all the Cabbage Patch Kids for my 4th birthday. I got the twins, and they had all the accessories. One of my friends' moms was a seamstress. And so we spent all kinds of time making all these matching clothes for the twins and all kinds of stuff. So when I was 11, I happened upon a pancake breakfast where we were at a park and there was the cutest, like Michelin, just chubby, bald baby. And I started playing with him on the playground and his mom was right there. And she's like, he just loves you. Do you babysit? And I was like, well, I'm 11. I don't know if I'm allowed to babysit yet, but I want to come play. So that kind of started my first career, if you want to call it, in mother's helper that turned into babysitting as I got older. And the reason that's important is that family ended up having another baby when I was 17, a senior in high school, and they invited me to be in the delivery room. So that was my first kind of experience in the world of the medical part of babies. And that experience of just being in the delivery room, being part of that with them, I was really just satisfied. I knew that I wanted to be a doctor and I thought I wanted to be a pediatrician, but really what I realized is I wanted to deliver babies. And so that's what I did. I mean, I went to college, I went to med school, and what I found in all the rotations that you do in medical school, trying to figure out what kind of doctor that you want to be, that I really liked family practice because you kind of got the best of both worlds. These days it's changed a little bit. There are still some family practice physicians that are delivering babies, and then you get to take care of them as well. So I got to do the peds part and the OB part. Well, what happened is about a year after I finished my residency program, I got asked to join an OBGYN office where I could do lots more obstetric and delivering babies and women's health, which I absolutely loved. So I let the pediatrics part go and just stayed with the OBGYN part. Well, I found myself fairly quickly when I wasn't delivering babies, dealing with all the hormone stuff that come along with not just, traditional annual exams. And what we know is that a lot of women use their OBGYN for their kind of primary care because they don't go anywhere else. So we were managing thyroid, we were managing high blood pressure, which is why they kind of brought me on to take care of some of that primary care role. But I was very undertrained in the world of hormones and hormone replacement. And, hormone replacement gets its negativity from, these studies that happened 25 years ago with the Women's Health Initiative that basically told us all hormones are bad and nobody should be on any hormones. And that just didn't sit well with me because I thought, well, there's benefit to hormones, we know, not only in treating a symptom, but also we know that there's some, bone health, heart health, brain health, all kinds of benefits to hormones. We just need to figure out how to do it right. But then there's this, what we're talking about today is sort of this group of women in their maybe 30s, mid 30s into their 40s that are like not hormone replacement, but not 20-year-olds needing birth control for either contraceptive purposes or for irregular periods or something. That's kind of the band-aid that gets used for everything. And I'm sure you've experienced that in the infertility world, is like, let's just put you on birth control for a couple months and reset the system, right? And then everything will be fine.
Yeah.
That didn't sit well with me either. So I'm like, there's got to be another way to do this. So long story short, I happened upon a conference about natural hormones and saliva testing and this world of bioidentical hormones that I never knew existed, never talked about. And it was kind of like Alice in Wonderland going through that tiny little door into this amazing garden and world of, color and light when we look at what we call integrative or functional medicine, which is really diving a little bit deeper into what the mechanisms are happening, what actually is the physiology that's going on. And so that's where I got started in 2008. So it's been almost 20 years ago of doing hormones, and it just has expanded to where I opened my own practice. I no longer deliver babies because they don't come on Tuesdays between 8 and 5, which is really the most convenient time for me. But I have 4 babies of my own, so it was time to kind of put that aside and really focus on getting people feeling their best and having the best life. And that's what we do now. So
Yes, that's amazing. And I love hearing stories that integrate the idea of there's got to be another way. And it tells me that I am not the only one. And for all of you listening out there who feel like I have been going down a path and I feel like this is the wrong path, let this be the sign that says there's another way. You can go somewhere else, because it's happened to me, it's happened to Dr. Duffy, and I just love hearing that.
well, it's helpful, as a medical practitioner, I get that all the time. Like, why don't regular doctors do what you do? And I don't know the answer to that outside of they don't have time. I mean, I think, to their credit, they're stuck in the system. They're seeing however many patients a day, sometimes upwards of 50, 60 patients a day. There's no time in their brain. There's just no space in their brain and their life to go learn something new. They're just in survival mode too. And it's horrible for them, but that's the situation, unfortunately, the medical system has put us in.
Yeah.
Even if you're seeing a specialist, they're still, in that system, and they're trying to figure out what your insurance will cover and, all that stuff. So, my advice to you is yes, to understand that there is another way, but you're probably going to have to go outside the traditional medical system to find that way too.
Yes.
But we're out there. I mean, I go to conferences where there are thousands of doctors that are learning, another way to do medicine, whether it's specifically hormone related or some other things. So it's a growing field for sure, that we're in.
Yes, and that's great, because we always find that we need another way, that the one size fits all way is not working, and more people are opening their eyes to the idea that again, that it's not a one size fits all. We can't just do this for everybody. And so I'm so excited about that. And so let's kind of circle this back to progesterone. So we'll start with, what is progesterone?
Well, I mean, progesterone is a hormone, just like all of your hormones to some degree. It plays, I think it has its specific known roles, and then I think it has some unknown roles that people don't really realize. Progesterone has kind of the main job that it does is right after ovulation. So, all the hormones need to work together, and there are several hormones that play a role in ovulation. But once you ovulate, now progesterone gets to go up. And progesterone's main job is to prepare the uterine lining for if there is contraception happening. Is that the right word?
Conception. Conception.
Like, not contraception. We don't want to avoid that. Yes, if there's conception happening, sorry, then progesterone continues to climb because it's gonna support the uterine lining until the placenta is really made, and then really progesterone even climbs from there. So if you have experienced any kind of infertility, they're madly measuring progesterone levels to make sure they're staying adequate to support that pregnancy, that sort of thing. So that's its main role. And just to follow that cycle, if you didn't get pregnant for that cycle, then what happens is that progesterone plummets and we have a menstrual cycle, and that's basically shedding that uterine lining for that cycle, and then it will, start the process all over again. A lot of I don't want to say a lot, but another way to look at progesterone is in terms of symptoms of when it's not there. So a lot of people experience PMS, or they can kind of get that feeling of what does PMS feel like, and PMS is premenstrual syndrome, if you want to think about it. So if you imagine after you ovulate, your progesterone levels are going up. And again, about day 20-ish, of your cycle, if you're counting your days, it would continue to go up if it got a signal that you were pregnant, but it drops very quickly if you're not pregnant. And so that time frame of about 5 to 7 days before your cycle starts, your period starts, that's a change from high progesterone to low progesterone. And it's the change in those hormones that make us feel the way we feel. So you can get moody, you can get irritable, you might experience some night sweats, you might be more bloated, you can have some breast tenderness, those sorts of things. So that's like this change. And you might have heard the term estrogen dominance before. So it doesn't necessarily mean that your estrogen's high, but your progesterone plummets really fast. And so there's an imbalance between your estrogen and progesterone. So that can
Okay.
happen in a 20-year-old. We're having these, changes in cycles, and there's all kinds of things that can go along with why some people have more PMS symptoms than others, and that's another talk altogether. But as we start to move into towards menopause, let's not say, but it can happen again in our mid 30s or so, that we start to see more and more of that change in progesterone compared to estrogen. And so we might get some irregular cycles, but that's a lot where this fertility issue comes in, is are we not making enough progesterone either to ovulate appropriately and or to maintain that uterine lining so that implantation can happen. So when somebody goes through infertility, a lot of times, again, they're measuring progesterone levels and LH levels and things like that, in terms of, are you even ovulating in the first place? Is there anything anatomical happening that's not letting the egg come through the tube, that sort of thing. There's a lot of things to look at, but we're talking mostly about progesterone today. So that's kind of
Yeah.
its main role.
Yeah.
And then we can move into, I'm assuming your next question is going to be, well, how does progesterone have its role in fertility, or where we're going to
Yes.
go next, right?
Yes, that was gonna be my next question. Why is it so important for, or why is it so crucial for conception and early pregnancy?
Well, again, it's taking over the role of, again, building that uterine lining. The as implantation doesn't happen for several weeks after conception happens, and so we're maintaining that fertilized egg and the embryo. We're making sure that there's blood flow going as implantation into the uterine lining happens. Progesterone needs to be really high to help support that as the placenta is formed. So if we're low in progesterone, often if we're low in progesterone, we're not getting pregnant in the first place. But if we made it and we got pregnant, but progesterone doesn't continue to increase, then there's more of a chance for a miscarriage to happen, because maybe implantation doesn't happen, or we don't get enough blood flow, the placenta doesn't form appropriately. So that's where you might see, very early 5, 6 week miscarriages happen because of a progesterone deficiency there.
And what impacts progesterone levels?
Yeah, so that's where I really want to dive into more so. Let's go backwards to somebody who's struggling with just getting pregnant in the first place, right? So, I mean, infertility can be, I can't get pregnant at all, or I'm getting pregnant, I'm having, multiple miscarriages, and they're sort of two separate things. So I want to dive in a little bit into how progesterone plays that role in that ovulation, as well as just, overall mood, I guess, and one of the things that I think is really important, and we talked about this a little bit when we first met, is, let's go back to caveman days for a second, right? Like, if we're out there and we're trying to survive, and one of the things that helps us survive is cortisol or adrenaline. So if we're being chased by a tiger, we're going to have an adrenaline rush. We've got to be able to sprint really fast and, jump up or lift something really heavy. You've heard that before. You get this adrenaline rush and you turn into, Superman, and you can lift a car up off your baby or something like that, right? So like in the caveman world, like in order for not only the adult to survive, but for a kid to survive, we've got to have the ability to make that adrenaline, that cortisol, or that stress hormone to deal with some of the stressors that were there. So what I see in our world now is that we are bombarded with multiple stressors in our world, and it's not necessarily getting chased by a tiger or a lion, but it's the little things over time and lots of stimulation. We've got sitting in traffic in a car, and we've got appointments and our phones dinging at us all the time, and not sleeping well, and we're just dealing with the multitudes, and it's just crazy. But we're seeing more and more people struggling with not high cortisol, but low cortisol. So what happens is that if we're sprinting the marathon of life, running uphill all the time and never really calming, never having a break, then we're asking our adrenals to kick out extra cortisol, and eventually the adrenals go, we have used it all up. Like there isn't anything left in the storage unit, and we don't have anything left. And that will continue for a while, maybe for years for some people, where they're just floating on this fatigue. And then what can happen is the feedback loop gets messed up. And so the brain goes, well, if you're not going to respond, then I'm not going to ask anymore. And so we can end up with really low cortisol. This is not as dramatic as like Addison's disease where you have no cortisol, but it's just kind of, we're just going through the motions and getting through the day. When we get to that place, I think what happens innately is that, when you go back to that caveman evaluation or caveman analogy, is if you're not going to be able to survive, then we're not, procreation comes after survival. So we got to be able to survive first, then we can procreate. If you look at getting really kind of scientific for a second, but we look at the map of how your hormones work with each other, progesterone and cortisol are right next to each other. And so what happens, and we see this very often, is that if cortisol starts to get low, it's going to actually sacrifice and pull that progesterone down to support survival first. So we tend to see in this area where we're struggling with getting pregnant, low progesterone levels, but then you've got to dig deeper and go, why? Why are my progesterone levels low? Because we can replace progesterone and we can support it, but there's got to be a reason behind that. And that comes from stress, and that comes from adrenal dysfunction. So I think that's really important, and something that a lot of people don't get and they don't understand. That you hear these stories all the time about people who are experiencing infertility, and then they try, and then nothing happens. And then sort of when they decide not to try anymore, maybe they go through the adoption phase or whatever, and then all of a sudden they get pregnant when they're kind of not thinking about it anymore. And I think that, I don't know the physiology exactly, but my thought process is that the stress gets better. They're not so worried about it all the time, and that release of stress allows proper release of progesterone to happen. So what I encourage, one, is that we can test that. We can do saliva testing, look at all your hormone levels, but also look at your cortisol levels. But two is, even if we're not testing and you can't find a doctor that's doing what I'm doing, just let's really dig deep into looking at some stress. And it can be external stress, and sometimes you can't control it, right? You've got to have a job. If you have little kids, other kids, you got to take care of your kids. We've got to have finances, all the natural stressors. But are we taking care of ourselves? Are we taking time to even just breathe? For some people, they're just going through the motions and they haven't taken a deep breath in years, to just sit down and breathe. So little things like that, we're seeing more and more about, rather than go, kill yourself in a gym, can we just take some walks outside, breathe some fresh air, that sort of stuff. The other direction that I really want to focus on is some internal stressors. So what's going on inside your body, your gut health plays a huge role in your internal stress mechanisms. And so we're seeing more and more issues with autoimmunity. We're seeing more and more like leaky gut type stuff, food sensitivities, and people go, why is this gluten thing happening? Like, 20 years ago, we never heard about gluten sensitivity. Yeah. What's going on now? Well, I think we're just bombarded with chemicals, and if you think about I remember when I was growing up, you'd go to the bakery to get your bread and, they had fresh bread that morning and then they had day old bread back in the back and it was like 50 cents or half off or whatever, right? And now we can go to the grocery store and you can buy a loaf of bread packaged in plastic that could sit on your counter for 2 weeks. So I don't know that it's necessarily the gluten, but it
Hmm.
is all the chemicals and the processing that goes into
Yeah.
keeping your food fresh, right? And not having to go to the bakery every day to get bread. Um, and whether we're talking about gluten or we're talking about anything, basically, the exposure that we have to the amount of chemicals and processed foods and things is just astronomical. And you may not notice it. You may not go, oh, it doesn't bother me when I eat those things. I don't have any, what we think of is gastrointestinal type symptoms, right? So I don't get reflux. I don't get stomach ache. I don't have any issues there. But we don't realize how much that may be playing a role in our body's response to stress. Your body's job is to keep you safe and keep you alive and survive. And so it's doing all it can to shove that down so that it's not interfering with your ability to function. So there may be some behind the scenes work happening that is affecting how we're managing our food, how we're exposed to things. And then the other part is toxins. And so all these chemicals that we're exposed to in our body, if you've ever heard the term fatty liver disease, that's not just for people who are alcoholics, right? Like all these chemicals that come in, our liver's job is to metabolize that and grab onto them and get them out of our system. But if that just like if you're trying to do load after load after load in your of laundry in your dryer, and you don't clean out that filter in your dryer every once in a while, your dryer is not going to be as efficient. We're not to the point where it's broken and catches fire or stops working, but it's just you find, oh, I got to run that load through again. It didn't quite get dry, right? Well, your liver is your filter and it's doing the same thing. And its number one job is to help you stay alive and keep you well. And so if it can't filter all those chemicals, then it's going to start storing them and it stores them in fat. So you may struggle a little bit with not being able to lose weight or if you have fatty liver, that a lot of that is because of toxins in our environment, and that's a huge stressor on our system again. So the more stress we have, whether it's known stress and stress that we can manage or do something about, or it's unknown, can we look at more deep testing? Are there foods that I'm reacting to that I think I'm eating every day that are healthy for me, but maybe for my own body that's causing a stress? Do I have leaky gut? Do I have toxins? Do I need to go through a detox? And please just don't go on the internet and buy some crazy detox. Like I'm saying that word, but sometimes a detox could just be not consuming, the things that have a lot of chemicals in them, or looking at the chemicals in your household. Are we using, a lot of chemicals in our topical things like makeup and lotions and things we put on our body, or our household chemicals, how we're cleaning, and again, it's not like you use one thing and it's going to make you sick and cause cancer, but it's the accumulation of all this stuff building up over time that starts to really stress out your system.
Wow. Wow, that's so much. I'm here taking notes thinking the biggest things that stand out to me was when you said there are things behind the scenes. And it just reminds me that we've been conditioned to believe that certain words like stress and detox only have one meaning, when in fact the meaning is so much more it's broader than that. So stress isn't just, we had another podcast about this. Stress isn't just emotional, but it's all of these things that are going on, like you said, behind the scenes. And that was something that it took me a while to wrap my head around, because I remember having a doctor telling me, oh, it's stress. And I was thinking, I am so calm. I have been the most low key, low stress that I've ever been in my life. And then I had to learn about all of those other things that you said, that the behind the scenes. Well, what about the stress that your gut is having? Even
Mhm.
if you don't feel the stomach pain, it could be experiencing other issues that you may not necessarily know about. And that's so wild to me.
I know, and that I mean, we find that a lot, and that's the case. I mean, yes, we can have a lot of people that are super stressed out. They got crazy jobs and crazy life at home, whatever. But again, you can have people who are like, I'm retired, like I don't have stress in my life anymore yet. I don't feel good. and I know we're talking specifically about fertility, but again, you might look at that and go, well, again, I feel like I'm taking walks every day, and I'm getting adequate sleep, and I've adjusted my job so that it's not as stressful, so that I can get this um if I do get pregnant, it's going to be a healthy pregnancy and all that kind of stuff. So we think that we're checking all those boxes, and those boxes are all important too. So I'm not saying don't do that, but if you're still not successful, then it may be worth taking a deeper dive inside and looking at some areas there. And again, if you don't have access to testing or you don't have time to wait for all those tests, I mean, just start thinking about, you put something in your hand, and you go, is this going to fuel my body, or is my body going to have to do some work to deal with this? Right. And and that's where we get into when somebody says, well, what should I eat? What should my diet be? And it's really important to just look at that and go, okay, well, again, if we can eat foods as close to their natural state as possible, we can pick an apple off a tree and chew on it and eat it, right? When you think about taking that apple and turning it into juice, there's a process that has to happen. And nobody goes and eats 8 apples in a 5-minute setting. So even something like apple juice that feels natural it's not normal for us to ingest that in that way. So when you start thinking about this food that we're eating, and we go, okay, can we have fruits? Can we have vegetables? And even if you cook a vegetable, it's still, it got picked and it, got cooked. And that's one step or two steps, if you want to call it. When you think about something like bread, even if you're not gluten sensitive, okay, but what does it take? We don't go out and pick wheat out of the field and start chewing on it. Like, that wheat has to be dried, it has to be processed into flour. Even then, we're not eating spoonfuls of flour. We have to then mix it and combine it with something and bake it. And, if you're not a bread expert, it's really hard to make that work and taste good at the end. And so that's my point, is like, even if we're trying to eat healthy, the amount of steps that it takes and all that processing that has to happen, if you just get to what's your protein, what's your good fat, what's your veggie, what's your fruit, are you getting the right nutrition, and is it something that your body has to work hard to deal with? And so that's a baby step that you could take right now, that you don't have to really, get fancy testing, you don't have to spend any dollars. Just find foods that are as close to their natural state as possible and try to minimize as many chemicals and processing as we can.
Yes, because it kind of goes back to what you said with the detox. The detox is not about drinking celery juice or drinking a specific uh, plan to be able to remove those toxins. It's about tons of things like making sure your liver's clean and filtered out, and you're sweating enough, and you're pooping daily. All of those things to be able to increase your natural detox pathways. And so it's not just that one thing we think we're going to buy it and it's going to work. It's the daily lifestyles that
Right.
should be working on
And
a
it may
regular
take
basis.
months, right? So that's why I think the frustration of like, "Oh, I did a 6-day detox and I don't feel any different." Like,
Yeah,
it's
a
gonna
lot.
take some time for your body to manage those stressors and get back to normal again. So, I'm just trying to give some ideas of things that you can do on your own. And, yay, if that works for some people and you're successful. If that either is overwhelming to you, or you've done those things for a couple months and you're still not successful, then it may be worth digging a little bit deeper and doing some testing, because sometimes we'll see people reacting to foods by, something like broccoli or avocados or chicken, things that we think are healthy, and we're still stressed about that. And so we may need to dig a little bit deeper. We may need to heal some leaky gut or some imbalances where there's bacteria undergrowth or overgrowth or something like that. So we can dig a little bit deeper, and that's what I do. But I'm trying to give us some easy solutions to start out with, to say, hey, let's just take a look at what I'm being exposed to, what's going into my body, as well as what's going into my brain. Like we talked about the stressors of, just everyday life and things like that. And so there's all kinds of things that we can do to start working on that. And again, that link between the stress and how that affects your hormones, particularly progesterone, is a really big deal. So it may take some time as you start doing that work. I mean, we tend to go cycle by cycle, and if I skip this cycle, then it's going to be a whole nother time frame. But that can be stressful too. So just kind of taking a deep breath, say, okay, it might take 6 months for me to reset my hormones by resetting my stress.
Yes, and I have a question about something that you had said early on, so I wanna back up for a second with regards to the PMS. And what role does spotting before your period play in identifying progesterone issues?
I think probably that's the case is that if you have some breakthrough bleeding and that can happen at different times of your cycle. So spotting at the ovulation is a little bit different than maybe some people who is like, my period's not supposed to start for a week, but I spot and then my period starts. That could be a little bit of a progesterone role there. It's really hard to measure unless we were, doing like daily hormone testing to know exactly what that is. But the theory is that the bleeding happens because progesterone levels drop and therefore we're releasing that uterine lining. So there could be a little blip where there was one day where progesterone went down but not quite enough to send that signal. The other thing is that spotting can happen if the cervix is irritated. So sometimes the spotting is not necessarily coming from uterine bleeding, but coming from like, cervix. Like let's say you scraped your arm and, you have a scab there. And if you bump it or you irritate it, the scab will start to bleed again. And so sometimes if you have some cervical irritation because you might have a yeast infection or a kind of silent or stealth bacterial infection, and if you have intercourse or something like that, you can have some breakthrough spotting just because it's more your cervix as opposed to uterine spotting that would be a hormonal issue. So it's hard to answer that question because it depends on what day it is. It depends on what happened the day before, all the different things that kind of go into that. But just giving somebody an idea of what that spotting may be saying.
Yeah, well, thank you for sharing that because I didn't know about all of these other different potentials that could cause just bleeding prior to a period. I only knew about the progesterone dropping. So it's good to know that there's other options and we just got to figure out what it is for you.
Yep. And it's hard to say, is it consistent or is it just a one-time thing? That's what I'm saying. We don't know if it's coming from the cervix. And a lot of times that can be a stressor too. If we have, I call them stealth infections. So it's like it's not an obvious yeast infection. So, a classic experience is somebody gets a yeast infection and they're like, yesterday I was fine. Today I'm itching like crazy. I can't settle. And I have this kind of thick white discharge. That's sort of a classic yeast infection. But you can have what I call it chronic or kind of the stealth yeast infection where it's maybe not so obvious. But that's a stressor on your system. So if your body's trying to fight this imbalance, and that can happen whether it's vaginal, it can happen whether that's in your gut too, where you might have some yeast overgrowth or you have some bacteria overgrowth, the pH isn't quite where it should be. That can create a cervical inflammation that doesn't allow proper opening of the cervix. So a lot of people doing infertility, they're looking at cervical mucus, and the theory is that when the cervix is open, the mucus is a little bit thinner, so you can actually see it and measure it. And when the cervix, when it's not time for fertility to happen, you don't have a lot of discharge or the cervix is closed. Well, if the cervix is supposed to be open but it's slightly inflamed, you can imagine, inflammation is going to kind of squeeze that hole closed. And so you're going to have some issues there with fertility just because sperm's not going to be able to get through there, when it should. So another important thing again for evaluation, and you would hope that fertility doctors are doing this, but maybe you're not at the place to go to infertility doctor yet, but your own doctor, primary care, you can just say, hey, can I just have an exam that's not my routine pap, but that's looking to see if there's any yeast overgrowth or bacterial overgrowth or something that we need to be aware of. And then that can be treated. It doesn't always have to be treated with prescriptions either. So, there are natural antimicrobial supplements to take. We can go through a lot of that. I don't want to say words, but there a lot of them have like oregano and caprylic acid, and there's kind of a mixture that will knock out both yeast and bacterias. Good probiotics. I mean, one thing you can do is just if you're not already doing it, whether it's your gut health, your vaginal health, whatever, is to take a really good quality high dose probiotics. So 30 billion to 50 billion probiotics that came out and that are kind of over the counter, like Align is one people talk about all the time. They're only 10 billion. And these days that's just not enough to counter. We've got antibacterial hand sanitizer and soaps and chemicals everywhere. There's chlorine in most people's water that's keeping us safe, right? But it's also killing our good bacteria. So
Yeah.
that can throw a pH off. That can create a stress on your system as well. So, step one is just find a really good quality probiotic and take that. Um, you can be fancy and try to make your own, fermented foods and kombucha and all that kind of stuff, but that's just hard to measure. I don't know.
It is.
You can try it if you want to and be that supernatural person, and that's fine. But I find it from that perspective a little easier to just take a probiotic.
Yeah. How do those probiotics impact progesterone? Does it impact it at all?
To some degree, if we're going way deep into, I mean, there's not going to be a direct, okay, you take a probiotic and your progesterone goes up. But again, if you go to that indirect, if there's an imbalance in the bacteria in your system that could be causing some inflammation, whether it's vaginal or in your gut, that's then creating that stress, right? And so that again is this chronic stress over time that you may not notice. Maybe you have a little bit of IBS, but you wouldn't even call it that, where sometimes you're constipated and sometimes you're going 4 times a day, but that's just normal for you. So you don't think that that's anything wrong. And that's not normal. So, but that could be just, again, this imbalance in your body and that could create stress. So I'm not linking it directly to it, but if you start thinking about those little stressors every day that play a role in your cortisol and your stress response, then that can lower your progesterone over time.
Yes. And you mentioned something a little bit ago about making sure that we're testing progesterone or looking at progesterone at the right time. So what is the best time to test progesterone and why does timing matter?
Again, this is somewhat dependent on what you're looking at, but when we're looking at just overall hormone balance and hormone health, then for most of my patients, we're testing in a window between day 18 and 20 or 21. You can kind of sneak it up that way. So again, we ovulate around day 10 to 14. Progesterone levels start to go up and they should peak right there around day 20. And then if we're not pregnant, then progesterone levels are going to start to drop again. So we're looking for that peak. We expect progesterone to be at a certain range, and it's hard to say numbers because different labs do different. So I'm not going to throw numbers out there, but we expect that peak to happen. So if the peak is low, then you can expect it's going to be low across the board, right? If you measure on a day when progesterone is already supposed to be lower, so in the beginning of your cycle or right before your period starts, we're already having low progesterone, then that doesn't tell us whether it's always low or it's just low because that's what it's supposed to be. So you'll see, when you get like blood tests for progesterone, oftentimes the reference range will talk about different phases. If you're in the follicular phase or the luteal phase or menopause, they'll have different reference ranges for that. And that's why that's important to kind of know where you would have been in your cycle as to what normal should be.
Yes, and when you say that that peak that comes after that ovulation, I think I've heard another guest say that it was something like 7 days post ovulation or something around there. If you do testing after that, are you looking for it to stay high? You said peak, so I would assume it goes lower. Where are you
Yeah, it goes
looking for it
down.
to be?
So again, it depends if you're hoping that you're pregnant, and we're measuring progesterone levels after to expect them to go up, right?
Okay.
So we peak and then they go to, this is just a routine regular cycle where that's the time frame where progesterone will peak and then it will drop if you don't get pregnant. Now, if you get pregnant, then it should keep going up.
Oh, okay.
So
So it
again,
shouldn't be the
are we,
peak.
are we measuring for evaluation overall of hormone balance and fertility? Is there a reason why we're not getting pregnant, or I'm pregnant and therefore I want to keep measuring progesterone levels to make sure that they're adequate and they're going up? Does that make sense? So it kind of
Yeah.
depends on the situation.
Yeah, I was thinking more in the situation where if we did it at the 7 day mark and it's high and it's peaked, but then we're thinking, did implantation occur? Are you still maintaining pregnancy? I know some doctors will do it like 11 days or 15 days post ovulation. Is that to check that they're stabilized to
Yeah,
hold on to a pregnancy?
correct. So the question might be that we're having contraception, but we're not having implantation.
Yeah.
right? And so it's like, again, there's so many different variables to what infertility means. Like, are we not ovulating at all? Or yes, we're doing LH tests, we're ovulating, we're having intercourse. We think conception happens, but then implantation isn't happening. That could be a progesterone issue, right? So a lot of people are prescribed progesterone post ovulation, whether it's vaginal or injections or something, trying to get that progesterone level up, um, so that implantation can occur and we can maintain that pregnancy until the placenta forms. So that's we're talking about kind of different phases of fertility depending on what we're dealing with there.
Yeah, and let's go a little deeper into that. When is progesterone supplementation necessary? And then to go a little step further, how do you even choose the right form? You just said there's a couple of different forms out there.
Well, I'm going to preface this by saying I'm not a fertility specialist, so I don't do anything like progesterone injections when we're trying to do, in vitro or, something like that. So that's a whole separate indication and category. But in my world, if I measured somebody at that peak, so let's say day 20, and their progesterone is lower than what I would expect it to be for that time frame, then we will often supplement topical progesterone. You can do vaginal suppositories as well. I have found oral progesterone to not be as efficient or effective. So this is really important because oral progesterone, when you take it, 90% of it gets converted to something called allopregnenolone. So you're only getting really like 10 milligrams of progesterone orally if you're taking a 100 milligram capsule. And so if you take that same dose vaginally, you're getting 100 milligrams, which is a much higher dose, or topically. Oftentimes topically in hormone creams, I'm talking about like a progesterone cream, the typical dosage is like one pump is like 25 milligrams. So we'll kind of play around with 25 up to 100. Again, I don't want somebody to go just get it and start taking it on their own. Like get some advice about what this dosage could be. Not that it's going to hurt you, but I just don't want it to cause any dysfunction. Um, okay, so if in my world, again, I'm not dealing with other types of infertility post implantation. I'm over here saying, is our progesterone levels high enough to keep, to get the uterine lining where it needs to be and to maintain this pregnancy? So we will dose progesterone right after ovulation. So we want to make sure we ovulate, and then we'll recommend that you do supplementation through that next cycle. And then once your period starts, you can say, okay, I didn't get pregnant this time. And so you can stop taking the progesterone between your period and ovulation. You don't use it. And then you use it again post ovulation to the next period. Now, if you don't get a period and then you end up with a positive pregnancy test, then oftentimes we will increase the dose and have you maintain that through the first trimester just to make sure we're not going to stop your progesterone and have kind of a drop happen and, induce something that we don't want. Does that make sense?
It does. And just to clarify, you're increasing it while they're pregnant to be able to help maintain that lining to help it stick to
Correct.
the wall.
So progesterone is supposed to increase, right? Once conception happens, and then it takes a couple weeks from conception happens in the fallopian tube, and then it's going to take some time for it to travel down there, and then a little bit of time for implantation to happen. So the placenta is not forming for several weeks. So that uterine lining is what's maintaining the pregnancy and maintaining that uterine lining. So we want to make sure that progesterone is adequate for that. So we're keeping it there. And sometimes we're even increasing the dose, and not crazy, but I might go, if we're doing 25 milligrams topical and we know you got pregnant, then I might go 50 milligrams or 75 milligrams just to be on the safe side, because your own body should be doing that anyway. This
Yeah.
is natural bioidentical progesterone. So we're not doing anything, synthetic or crazy. If you increase progesterone that's already supposed to be high anyway, then you're not going to cause any harm.
Okay.
And
Yeah,
that's
that's good to hear.
infertility. Women are often given vaginal, progesterone suppositories to take when they find out they're pregnant, again, to help support that or protect, miscarriage, that kind of thing. Again, way, way beyond that when somebody's dealing with like pregnancy loss from low progesterone, where they're going into early preterm labor or something. That's a whole nother thing, but a lot of people are on progesterone supplementation for that as well. But I'm just talking about right there at the let's get pregnant time frame. We
Mhm.
can use progesterone supplementation there.
Yes, and you're choosing that based off of, again, the blood work that you know this person is deficient in progesterone, so that's why you're choosing to supplement.
Correct. Because we tested at that window where it should be at its peak and it's not there, which then we can imply progesterone's low across the board. Let's go ahead and get it up during that time in your cycle when it's supposed to happen. Now, meanwhile, we're doing all these things, right? So
Yeah.
we can test it and we can see progesterone's low, but that's not the end all. We can support that. Okay, let's go ahead and start supporting progesterone so it gets up there. However, let's talk about why is a, healthy 32-year-old doesn't have enough
Yes,
progesterone. Where is that coming from? That's going to go back into the stressors we were talking about, any other imbalances. We look at vitamin D levels, we look at omega fatty 3s, B12, so nutritionally is everything where it needs to be as well. Thyroid, absolutely. I mean, if somebody's going through infertility and hasn't had their thyroid checked, that's a big stressor, although you would think you would have some symptoms, but sometimes you don't. If your thyroid's not working, nothing's really working. So we got to make sure that's not a reason for infertility as well.
and you listed several different health issues that could impact fertility and could impact progesterone. So I want to make sure I ask this question before we end. How does low or insufficient progesterone impact men?
That's a tricky question, but progesterone's job in males, and males do have a level of progesterone that they should have. Most of the time, when I'm looking at progesterone in males, I'm doing it more from a prostate health perspective to make sure if we're going to do some testosterone replacement in men that we don't want overstimulation of the prostate. So progesterone actually blocks estrogen receptors. And it does so in women too. So in breast health, for instance, progesterone is really important for maintaining a balance of stimulation to breast cells. So when we're talking about breast cancer, I know I'm going off on a crazy tangent, but oftentimes that's again an estrogen dominant thing. We have too much estrogen stimulating our breast cells and not enough progesterone to help kind of block them. Um, so in men, that's where I'm looking at progesterone most of the time. I don't usually see men for infertility purposes. However, I can't imagine that, and I'm saying this without a whole lot of scientific data, that if our hormones aren't balanced, then things aren't going to be working. It may be we have less of a sperm count, infertility reasons from a stress, same thing. If males have a lot of stress, their job is to protect that baby too. And so, there could be some issues there with low sperm counts or something like that, just because their body is in a place where it's like, I don't know if procreation is a good thing for us right now. Does that make sense? So
Definitely.
I haven't experienced males, dealing with the male side of fertility and having low progesterone levels and supplementing that and saying, okay, that fixes everything, and now you're fertile. But if men got tested and saw progesterone levels low, that certainly could be something to consider. And I'm just caveat that if men have low testosterone, that can be an issue in fertility for sure, but also testosterone replacement can lower your sperm count. So you got to have a really important
Yeah,
balance and looking at those levels and what's important and testosterone replacement in a appropriate way so that we're balancing that. And so I will give males progesterone to support that when we're doing testosterone replacement.
that's very interesting. Yeah, thank you for sharing about that because, like you had said early on, progesterone and cortisol, that if you have too much or too little cortisol, if that's imbalanced, it's going to impact progesterone. And then the same thing for men. If that's imbalanced, if they're stressed,
Absolutely.
it's
And
going
in
to
men,
impact
we see
that.
it actually impact testosterone pretty significantly too. So
Wow.
adrenal stress can lower testosterone. So if a
Wow.
male who's supposed to have high testosterone has low
Mhm.
testosterone, your brain should go, why? Not just go, oh, you have low testosterone, here, let's replace it.
Yeah.
Why does this otherwise seemingly healthy 30-year-old male or whatever have low testosterone? you need to dig a little bit deeper and figure out where that's coming from. And oftentimes that's that stress response.
Yeah. Again, digging into the why. Why is this happening and how can we help support it to be able to do what it's supposed to be doing? Yeah, so as we come to a close, I've learned so much. So thank you so much for sharing your knowledge. As we come to a close, do you have a couple of tips that you can share with the listeners who are wanting to to improve their progesterone?
Yeah, I mean, we've alluded to them a little bit, but just in summary, again, I would go as easy as to say, hey, what's stressing out my system, and how can I control that? So whether that's the food you're eating, and literally look and go, is this food going to be fuel for my body, or is this food going to be something my body has to work hard to do something with, right? So the harder your body has to work to deal with it, the more stress it's going to create on your system. So look at your food, look at your environment. Is there anything that we can look at that we can, again, eliminate or control in terms of environmental exposure to anything? Um, Look at your mental health, and you guys have alluded to this before, but just, are there ways that I can, take more deep breaths? Can I get outside a little bit? Can I change the way that I exercise so it's less stress on my system and still get the results I'm looking for? Those are some baby steps you can do if you can't change your whole world of getting a new job and a, new life. We don't really want that, but everybody says, oh, I wish I could manage my stress better, but I have a crazy life and like, this is just the way I am. Well, okay, there's, words matter, and how we talk to ourselves matters. So if you're running around going, oh my God, I'm so stressed and I'm miserable all the time. Well, your brain feels that and your body feels that. So, gratitude, five things I'm grateful for. What's good that happened today, even though you may have had 32 things negative that happen, let's talk about the positive. So those are all little ways that don't cost anything, that don't require you to go find testing and, all that kind of stuff. So baby steps matter. And, even if we did the testing and we found those things, we're still going to recommend those habits need to be looked at and changed in order to support what's out of balance. So those are some not always easy steps, but those are some steps that you can start to look at on your own.
Yeah. Basic steps aren't always easy, but they
Yes,
are the basic fundamental things that we should all be doing. And like you said, we can do all of these things now before we even get to a specialist.
exactly.
Awesome. And if somebody wants to connect with you further on this and what you do, how can they reach out to you?
Yeah, our website is carolinaintegrativemedicine.com. So that's my office website. Aimee Duffy, MD, is also another place that you can go. That's more finding my podcasts and TV segments and things like that, less clinical stuff there. I'm on all the social media platforms. So just make sure you spell my name right. It's AIMEE. So you'll see that on the podcast title. But that's the easiest way to reach out. On our website, there's a place that says work with me. And then, you can go through the steps if you want to reach out and have some questions. This always comes up, and I don't know where this podcast is going to go, but we're in South Carolina. We're licensed in South Carolina, North Carolina. So if you're in those areas, we can see you, whether it's in person or virtual. If you come visit us, even if it's just a one-time visit, we do some testing, that kind of stuff, then we can see you virtually. Beyond that, if you're in a different state, we can work through some of those runarounds. The beauty of COVID is that we learned how to use Zoom, and we can do a lot more virtually than we used to be able to do, or that we were comfortable with before. So, um, you know, gratitude for that. Even though that was a very negative time in our world, it has really changed the way that we can help people.
Yes, wonderful. Thank you so much, Dr. Duffy. I appreciate you coming on the show.
It was great to meet you.
Thank you. And thank you so much, listeners. I hope you have enjoyed this episode. And if you have any questions or comments about this episode, feel free to put it in the comment section. And until next time, take care. Thank you so much for joining me today on the Empowered Fertility Podcast. If you're looking for personalized support on your journey, whether that's through therapy or coaching, please reach out. Just complete the contact form linked in the show notes, and someone from my team will be in touch with next steps. Remember, you are not alone. You are not broken, and your story is not over. See you in the next episode.